for days, weeks, months, years, decades. So there's, most of the time when people talk about status, they're talking about convulsive status. So a grand mal seizure or a convulsion or a generalized tonic-clonic seizure. And you fall to the ground, you're stiff, and then you start jerking. And that just doesn't stop. It just goes on and on and on. And as I said earlier, for updating the people that just arrived, the new definition of status is a seizure that lasts 10 minutes or longer. The original definition was 30 minutes or longer. And the longer that seizure lasts, the less convulsive it becomes. So when the seizure first starts, the child or the adult is really stiff and jerking. But after half an hour or an hour, they might just be zoned out or just have a few little twitches or jerks. And it can be more difficult to recognize that the patient's in status the longer the status lasts. So that's why it's sometimes important to get an EEG done after a seizure, and that's why your doctors might be wanting an EEG after someone's had a prolonged seizure, just to be sure that it's over. If somebody's had a seizure and they're awake, talking, making sense, well, then the seizure's obviously done. But if they had a convulsive seizure and they're just now laying there and they're not responding normally, they don't seem to be coming around, it could be that they're just post-ictal. And the longer that seizure lasted, the more post-ictal they'll be. But usually if you're post-ictal, you're partially responsive, you're sleepy, you can open your eyes, you might not know where you are, but that should start getting better. But if it's not, it could be because the seizure hasn't stopped and you need treatment in order to stop the seizure. And an EEG would be a good way of telling the difference between a deep post-ictal state or ongoing seizure activity. Seizures can be other kinds of seizures though too, right from the beginning. So we often differentiate